Hi, welcome to Detours Understanding Acquired Brain Injury. And what I'm going to do is I want to talk about some very common problems that are all connected and talk about some of the neuroanatomy and some of the treatments for these common problems. In fact, this is probably one of the most common kinds of problems that we see with traumatic brain injury survivors afterward. But I'm going to try to break this down so it's a little simpler. So what I'm talking about is irritability, anger, aggression, and the associated problems with these symptoms. A large percentage, about a third, of anyone who has traumatic brain injury has this disorder, has problems with these kinds of symptoms, who has traumatic brain injury. So I want to first of all start off with the most common, but probably the least severe of these, to use that term. When it comes to irritability, it's probably the most common of the anger and aggression kind of problems that you'll see, but you'll bump into it the most often. Irritability is kind of like snappiness, and kind of the showing of anger in response to relatively trivial stimuli or even something that isn't a problem or a threat. In early brain injury, this would be in response to really any stimuli. And a lot of it comes from problems with, I'm going to use my friend here, problems with a left dorsifrontal, dorsolateral aspect of the frontal lobe. And trouble understanding basically what's going on. Trouble understanding level of threat, level of harm of something. Problems here lead a person with even mild traumatic brain injury really having problems understanding what's going on. They would often also problems with white matter fibers, trouble communicating, this region of the brain communicating with the rest of the brain. And especially early on, much faster kind of reaction to any stressor. And so the good news is that these early kind of reactions tend to resolve in time, and for most people too. It goes away. Those who keep these traits, those who have continuing irritability, this overreaction to trivial minor stimuli, it tends to be intermittent. It tends to be fairly regular despite being intermittent, and it tends to be, this is important, ego dystonic, meaning that it is against their general nature or at least neutral in relation to it. It is not something that is part of their general personality, even post-injury personality. This is something that's not something you generally associate with them. And so even the person finds it kind of, whoa, that's not me. And so they need assistance with this and they need it treated. And fortunately, the treatment for this irritability is pretty straightforward. It's hard work. I'm not going to deny that, but there are answers to this for the late irritability, and they relate to helping with behaviorism, with using behavioristic and cognitive techniques. First of all, some of the techniques are changing thinking, helping the way through psychotherapy and cognitive behavioral therapy. So regular psychotherapy has shown to be very effective. Some of the studies show, most of the studies show that cognitive behavioral therapy is more effective than medication. There is one medication that is the kind of the gold standard for the most severe cases, for cases that really are resistant, or for people who have fairly significant cognitive impairment, where their thinking is just so poor that they need extra medications to help them. So as far as cognitive therapy, small group, and help people learn who have this, help learn to understand what is and is not a threat, to help look at and examine ways of thinking and alternative responses. Working on that in groups that are dedicated to people with traumatic brain injury. Help from the family, reinforcing alternative responses and pointing out. Obviously, this is a cooperative kind of thing, but pointing out when somebody is being irritable over something that's not an issue worth being overreactive to, and pointing it out requires that kind of ability to work together, and it requires that the person who is the caretaker or the family or members or whoever's working on this not be aggressive in tone, not be angry, not be combative, because if you become irritable, it adds to and fuels that kind of a problem. But it does require persistence and, hey, this is how the situation is, this is what's going on, and a calm and measured tone with a person, and possibly a withdrawal of attention, leaving the room, whatever. This is not acceptable, and setting those boundaries that are necessary for what is okay and what is not okay. Overreaction, yelling, being displays of anger over something that's trivial or nothing, not okay. But everyone's got to stick to it. And this applies later when it comes to aggressive displays as well. But same thing with that kind of snappiness, that kind of thing. And you have to be consistent. Can't give in to that. And consistency is important. And providing alternative behaviors, also very important. An alternative way of handling anxiety and allowing them another route to express if they're afraid of something or confused by something, a different way of expressing it. All good techniques. A behavioral analysis. There are literally forms on the internet and forms that could be used by a psychologist to track those kind of behaviors that lead to expressions of irritability and finding out what's going on. And of course, many people who have problems with irritability had a problem with this before. And so finding out, are there comorbid psychiatric problems? Is there a history of mania? Is there a history of psychosis? Is there a history of depression, anxiety? Are there other mental health problems, PTSD, a history of abuse, personality disorders? It's easier to treat the comorbidities than it is to treat the irritability outright, because the irritability is often a symptom of something. Is there chronic pain? So taking care of those problems first and resolving those problems to the best of your ability makes it easier than if the irritability persists and if it's more pathological, going after that. Now, pharmacologically, if the person has problems with psychosis, or if the person has problems with, more of a, not psychosis outright, although it can contribute to irritability, but if the person has problems with cognition, if the person has problems with cognition and understanding, and they still their thinking is slowed, they don't really cannot understand a situation, and they remain irritable because of fear or lack of understanding of the situation, amantadine, the drug amantadine, has been shown in studies to be very effective. So amantadine as the prescription, it's effective. It's effective in helping with reducing irritability. And studies show it's similar in effectiveness to most kinds of therapy. If you have a very rigorous program of behavioral treatments, cognitive treatments, group therapy, continuous monitoring things, then it's about the same. But unfortunately, most people do not receive this very intense therapy. And so that is something to keep in mind. And so amantadine can be helpful. And again, helpful for those with problems with their cognition. Okay. So just wanted to go over that. So irritability is probably the leading problem when it comes to anger, aggression, irritability, all those kind of things. And so what we'll be doing is next, we'll be looking at like aggression and the problems with patients who are aggressive and how you treat that. And we're talking about medications and like more details about therapy next. But so I wanted to get into irritability first and some of the things we could do to treat that. Okay. So that's next. But thank you for watching. Please click like and subscribe. Have a good day.